what can basic income do to address things such as the cost of healthcare interventions and access to mental health support?
We have universal healthcare in Canada. Why should a basic income lead to better health outcomes in a country that has a universal health system? And I'm going to suggest that it's because of the way that basic income works through the social determinants of health. It works to make some of our public services more efficient and more effective. So I want to tell you a story. I just want to give you a little example. It's not a particularly sexy story. It focuses on feet. Feet and teeth are two sort of informal markers of class in Canada. So mine's about feet. Type 2 diabetes is one of the most prevalent chronic conditions that we have in Canada. If you're diagnosed with diabetes, that's not sufficient in and of itself for disability support. You won't necessarily get the disability tax credit or access to provincial disability supports. So a lot of people with type 2 diabetes are working or they're subsisting on provincial income assistance. And when we look at the incidence of type 2 diabetes across the population, we know that people whose incomes fall in the lowest 20% of the distribution, the lowest quintile, get diagnoses of diabetes at twice the rate of people who are in the highest income quintile. Now that's interesting, but what's even more interesting is that once you're diagnosed with diabetes, you're vulnerable to a number of complications, and one of the complications is lower limb amputations, foot amputations. It turns out that foot amputations is something called an ambulatory care sensitive condition. And what that term means is that if you have access to good quality primary health care, you should never lose your foot due to diabetes, right? It just shouldn't happen. But if you look at the numbers, about 3 times as many people in the lowest income quintile lose their foot, have their foot amputated due to complications of diabetes as people in the highest income quintile. So why do you get these results? In principle, everybody in Canada has access to good quality primary health care at zero cost. And yet we see real outcomes in terms of the quality of health that people receive. And I'm going to suggest that it's because basic income is working on all of the very many complicated social determinants of health that leads to those results. First of all, we know that managing diabetes requires a good diet. We also know that someone on provincial income assistance with no dependents in most provinces gets something like $9,000 a year. We know that food banks aren't a really good source of fresh fruits and vegetables. There used to be a special diet allowance for people on income assistance but not receiving disability support in some provinces that would give a little boost, a little increase in money, but that's been curtailed in most provinces. Secondly, we know that stress exacerbates inflammatory responses within the body, and it exacerbates complications of diabetes. People with inadequate incomes live from crisis to crisis. Stress is a fact of life. They're simply living with more complications. Thirdly, people with low incomes are much more likely to live and work, often with appropriate foot gear and conditions that lend themselves to foot ulcers. They're more likely to be hurt, which leads to worse outcomes down the road. We know that primary health care is free in Canada, but transportation to your appointment is not free. Childcare is not free. After hours access aren't free. Specialized services are often only available in the city. Therefore, your income affects your ability to access public services. We know that in some, but not all provinces, orthotics and foot care are provided. Sometimes they're provided only to people who get disability support. Sometimes they're provided on the basis of income. If you live on reserve, it's not provided. But in any case, even if you're lucky enough to get orthotics, they're meant to be worn inside well-fitting shoes. There's no program in place that buys people shoes. You can access foot care in the private market. It costs about $70 for somebody to drive a van to your house and take care of your feet. But here's the biggest issue of all. I said when I began that teeth and feet are sort of the informal markers of class in Canada. People who are missing teeth are immediately classified, and feet are similar. It turns out that people are embarrassed by their feet. They're embarrassed to visit health professionals for foot care for all kinds of reasons. Their clothing, their shoes, their socks, their foot care regimen put their poverty on display immediately. The stigma of living with poverty is very present in that kind of an environment. And all of that has a whole series of effects. It means, first of all, that people with low incomes present later than high income people. Their conditions are usually more acute. They necessitate more drastic responses from the healthcare system. It turns out that low-income people tend to be diagnosed with chronic conditions about 10 years earlier than high-income people. That sounds inconsistent, but it's not. They simply get sick earlier. By the time you find them, they're in much worse condition. So all of that shows how healthcare services alone are not sufficient, that a basic income actually lubricates the system. It actually makes it possible for people to take advantages of the services that are made available to them. You asked me about costs. It turns out that some of the cost is very direct. Poor health that leads to hospitalizations and drastic interventions like foot amputations are pretty expensive. They have direct and they have indirect costs. Keeping somebody in a rehab hospital for weeks or months is expensive, but the indirect costs, the intangible costs, are even greater. If the patient's previous work involved physical labor, they need to be retrained. If the patient lived in a rural or a remote setting, they might need to relocate to the city to get health care on an ongoing basis. We know that lower limb amputations are associated with premature deaths, so years of quality life are going to be lost by individuals who face these complications. So the costs are material, but they're also intangible and they're all too human. And I think one conclusion of this is very clear. Universal services are never really universal. The most marginalized people in society would be better served by our public services if they also had access to a basic income, to a guarantee that would allow them to make use of services. Thank you.